One Quebecer is calling out the healthcare system, which she says is not covering her $60,000 breast cancer medication. Jessie Putre wants to tell her story about being stuck between both the public and private system. This after she was diagnosed with breast cancer and opted for a mastectomy. Putre says she's been going back and forth between the RAMQ and her private insurance, and Jessie is on the line. Hi, Jessie. Welcome to the program.
Hi there.
Tell us your story. Let's go back to diagnosis here and how your life changes.
Sure.
Why don't you take us from the start?
Sure. While I was on vacation and I discovered a lump, I immediately called my general practitioner, and he was headed on vacation. So he mentioned at that time that I should, wait and see. It could just be something hormonal, and then, call him back if it doesn't go away after his vacation. So something didn't seem right to me. It didn't feel like something I wanted to wait on. So I opted to go private. So I called a private clinic, and they took me within 2 days. I was in, I did an ultrasound, I did a mammogram, and then from there they were able to see that there was a tumor. I did a biopsy on the spot, so all within 1 hour. And they were able to tell me that it was quite far along, and that I would need to go in and get a mastectomy as soon as possible. That was the best course of action for me. So I obviously decided to move forward with the private system and do that to avoid any waits at the advice of the surgeon. So I did that and then went into recovery from there. And then at that point, my surgeon helped me transition into the public system. So I was given an oncologist. And they told me that in addition to having to do chemotherapy, I would also have to do an antibody treatment. Because in addition to having invasive ductal carcinoma, which is my form of cancer, I'm also HER2 positive, which is something that only 15 to 20% of women who have breast cancer have. So it's a very aggressive form, and it's also a type of cancer that is prone to recurring. So I obviously want to do this antibody treatment, but they told me that I could not just, move forward and get the Perjeta antibody that I need because I had chosen to do the mastectomy first. So all of the doctors in the public and the private system agree that I made the right decision for myself in moving forward with the mastectomy because it was the best course of action at that time for me. However, the way the public system is designed, by the way it's been explained to me, it's not their process for me to be able to get this drug, considering I got the mastectomy first. I would have had to do it the opposite way.
Jessie, first thing I want to get to here, because I think there's something out of your story here that we should take away right off the bat before we get into the medication stuff, and that is you trusted your gut that something was wrong, right? And I've heard this story time and time again. Because, listen, doctors are doing their best, right? I mean, I really do feel that. But you had to trust your gut not to wait. Out of your story, would that be some advice you would give others there? If you feel it, follow your gut to get that care?
Oh, absolutely. I mean, if I would have waited, I would have had, lengthy wait times with the public system. The cancer would have spread even further into my lymph nodes. My prognosis long-term would have been worse. So, above all, I want to have, a long life. So, and I believe, everybody should take immediate action in a case, such as mine. And do what you need to do. So I'm very happy with what I did, and I think everybody should continue and do those type of things. Absolutely.
So let's talk about your need for this medication and how does not having access to this or this medication not being covered.
Well, this is it. So I went and I actually, the doctors told me to speak to my insurance company. So I went and I spoke to them. I filled out the necessary paperwork. I submitted the paperwork and they declined me. So, and their reasoning behind that is because they feel that the RAMQ should be covering it, the public system. So went back to the public system, explained that to them. And again, they said, well, we need to go back to your insurance. So filling out more paperwork. So essentially, I'm caught in a ping pong between the public and the private system. And it's unacceptable, that people like me, in desperate need and having to move forward with treatment, have this extra stress and this extra burden,
Yeah. And a delay here for you, delaying taking this drug. What could it mean for you long term?
If I choose to delay, which is not something I plan on doing, though, I am moving forward regardless. I mean, I need to do this. Financially, it's just, the doctor, unfortunately, my oncologist even told me, you need to put money aside in these situations. But, to make a remark like that is it's not something that, can be taken lightly for someone in my position anyway. And, moreover, further than that, I was actually given, different prices from the oncologist as well from the beginning, just for your awareness. They initially told me it was $25,000, and then only to find out in passing at an appointment last week that, it's $60,000. And in fact, they went back again and it's $68,000.
My goodness.
Yes. So, I mean, you know what? Like I told my oncologist, but before you give prices to people, especially we're a week away here, you need to make sure you have your facts. Like, it just doesn't make sense that there's such disorganization and chaos, for people who are already struggling and suffering. Something needs to change.
We are with Jessie Putre, a Quebecer who is, as she puts it, playing ping pong between the private system and the public system, trying to get coverage for a drug she needs to breast cancer medication. So, Jessie, you say you're going ahead, right? But you may not have coverage. So, what does that mean? You're going to pay for this out of your own pocket?
I'm going to pay for what I can. I am also, pleading with the public. I have a dear friend who is working, to help me with a fundraiser. We have a GoFundMe going on right now. We've been very vocal about it on social media, on all forms, and the community has been just amazing. I mean, the response has been phenomenal. There's a lot of people supporting, donating, liking my posts on social media, sharing my posts. I'm just, I'm very, very touched and humbled by everybody's support. It's really fantastic. So I am very hopeful, that with the support of everybody that I'll be able to get this treatment that I need. But more than that, though, it's just, it needs to change in future. Things like this shouldn't happen, because of processes and because of budgets with hospitals,
Jessie, how does it feel when you've got to go and make a public plea? Like, I know for a lot of people, that's a difficult decision. I'm going to do the GoFundMe, or I'm going to go onto social media and make this public plea. How did that feel when you made that decision?
Well, you know what? I mean, for me, I felt very helpless when I was initially diagnosed with this cancer, and this very aggressive form of cancer. I usually am able to take control of my life, and I felt very, that I couldn't do anything. But, now I feel like this is something I can do. I can speak up. I can create awareness. And at the same time, I can try to help myself, and let people know what's going on. And the response has been great, honestly. And
Jessie, and I think media does have a role to play in this. I think, sometimes we've seen examples time and time again. You do interviews, you speak to the media, and that actually can force people to move a little bit quicker on that front, but also reaching out to politicians. Have you spoken maybe to your local MNA
Well, we have tried. We have reached out. We have sent emails, phone calls. We've tried to reach out to the Minister of Health. Unfortunately, it just seems to be falling on deaf ears. I have yet to receive a response from anybody.
Who's your MNA, if you don't mind me asking?
I'm not sure, to be honest, offhand, but my husband is taking care of everything in that respect. He has, been reaching out. We've been very vocal. I've spoken to several, news broadcasters, live for television as well. And unfortunately, I just have nobody getting back to me. We've tried all different forms, and it's really, really unfortunate. They say they're there for the people. We're here to help you, and yet we don't have any response.
And the other thing here is I'm looking at you, and you seem like you're taking care of yourself. You're doing a lot of hard work yourself, but you got covered. Yeah. You have private coverage. You have our RAMQ. You've got two types of coverage. You're doing the work, and you're still not getting covered here. It is incredible. Jessie, I'm happy we could give your story some airtime here. Thank you so much for joining us.
Oh, thank you for having me. I really appreciate it.
That's Jessie Putre's story right there.